So as runners, I think the joints that are usually more affected would be the lower limb joints, because these are your weight-bearing joints. So we are essentially talking about the hip, the knee, and the ankle. The commonest injuries in runners are usually related to the foot and ankle and the knees, less likely the hips. Firstly, listen to your body. For example, if you have pain in either your foot and ankle or your knee that persists for more than 1 week in a row despite rest and medications, seek advice early. It is not normal to have pain that persists that long with rest as well as medication. So if that happens, look for a professional, either orthopedic surgeon or sports physician, who can assess and advise you. For example, you might be suffering from stress fracture, you could be suffering from chronic inflammation of the tendons, you could be suffering from a cartilage injury to the affected joint. So if these are caught early, better treatment can be given to the patient. Secondly, always do stepwise, step-up training. Do not run a marathon immediately. I think this is common sense advice. So do step-up training, listen to your body. If hit a certain mileage, a certain weekly mileage, and pain starts to come in, do not believe in the adage, no pain, no gain. Because pain is the way that your body is trying to tell you that there's something wrong. So listen to your body and follow my first rule. If the pain persists for more than a week, despite taking rest, despite medications, then seek a professional help. Glucosamine is basically, in a simple sense, it's a simple sugar molecule. It exists in different forms. It is already present in our body. It's a naturally occurring sugar molecule. In the market, the common kinds of glucosamine will be glucosamine sulfate and glucosamine hydrochloride. Most of the clinical studies on glucosamine have been done on glucosamine sulfate. That is the most studied form of glucosamine sulfate. Glucosamine sulfate, to break everything down into simple terms, it is essentially a good anti-inflammatory agent without the side effects of painkillers. That's the way I look at glucosamine. So what does an anti-inflammatory agent do? It basically reduces pain, reduces swelling, and reduces inflammation. So for example, if you have a joint that is inflamed, the joint is swollen, then glucosamine can help to a certain extent to reduce the swelling, pain, and inflammation in that particular joint. The common advice I would give to patients is that take 1,500 milligrams per day, not more, not less, because that's the effective dosage. And if you have taken it for 6 months and above and you see absolutely no change in the symptoms, then maybe it's time to consider other supplements or to stop it completely, because these supplements are not exactly cheap. Some patients also ask me, since this is a glucose or sugar molecule, does it affect me if I'm diabetic? The answer in short is no. It does not really affect patients with diabetes. It does not affect their sugar control. It is quite safe, and only very, very, very rare instances have they seen patients who are diabetic and who take glucosamine sulfate get disturbances in their sugar control. Other than that, it is a pretty safe supplement with minimal side effects.